So let's solve the challenging case 154. Now in this challenging case, I presented an ophthalmic investigation and asked few questions. Now what were the questions? What is this investigation? So it is a B scan ultrasound of the eye, in fact both eyes. Why it is done? Well, it is done in opaque media like corneal opacity, corneal scarring, hyphema, blood in the anterior chamber, dense cataract. When you are unable to see the posterior segment of the eye, vitreous hemorrhage, to confirm the health of the posterior segment, vitreous and retina. Then I asked the third question, that why it has been done in this patient. So this B scan shows the vitreous and retina of both eyes, and there are hyperechoic round shadows in posterior vitreous that depicts the posterior dislocation of crystalline lenses in both eyes, and there is retinal detachment in the left eye which is attached at the optic disc. Now question arises that what condition can lead to such drastic situation? Well, ocular trauma is the most common scenario that comes to our mind, which can lead to lens dislocation and retinal detachment. But in this case, there is no history of trauma. Now let me present this patient. Now this 65 years old male patient, tall, thin, very long arms span more than height, spider-like long fingers, had a history of ectopia lentis superotemporal since adulthood that gradually increased through decades, and now he is total aphakic. I hope now everyone has solved this case, that this patient is having Marfan syndrome and now presented with spontaneous degradation of all its zonules, leading to posterior dislocation of both crystalline lenses in vitreous. You can see here that there is a jet black shadow in the pupil, so that is aphakia. Now unfortunately patient was very photophobic, so I couldn't make the video of bilateral lenses that were present inferiorly in the vitreous, but referred the patient to vitreoretina facility for VR surgery. Now it was the first case of my life of Marfan syndrome in which both lenses were dropped posteriorly and at such an old patient of Marfan. So I hope you liked it. I have also made a separate playlist for B scan series, so if you want to study B scans in depth, you can watch that playlist. I have already separate playlists for visual fields, OCTs, and corneal topography as well. Thank you.